Hello, my name is Alexa Bourne. I'm here today to talk about patient-centered building design. Because healthcare facilities are made to serve patients, it is important to ensure the building is accessible to patients' needs. According to Railing, Hughes, and Murphy, 2008, how a facility or a structure is designed has various impacts on patients' needs and their safety. Therefore, I want to discuss a few different ways to make patient-centered buildings possible. I will be using a peer-reviewed article, a newspaper article, and chapters 7 and 19 from my quality management book to display the value of patient-centered buildings. I will also be explaining how Silver Cross Pavilion a patient-centered medical building, has been designed to make patient care convenient. To provide patient-centeredness in healthcare facilities, designers need to take into consideration patients' privacy, health, and safety. First, I want to discuss how hospital designs are being poorly built in accordance to patients' health. Dhruv Kalar, MD, 2017, walks the halls of the hospital and notices non-sanitary and uncomfortable situations for the patients as well as a medical resident. The first problem is the shared rooms with a single sheet separating patients. One patient is crying and coughing while the other is trying to sleep. In addition, Dhruv Kalar, MD, 2017, states a good point by explaining how the staff cannot keep one patient's information confidential when there is another patient in the room, separated only by a sheet, and which also abides by the Health Insurance Portability and Accountability Act. Furthermore, falls by patients is the #1 issue in hospitals, Kalar, 2017. Which in fact causes patients a longer amount spent in the hospital and more money spent, Kalar 2017. Due to this, designers need to find a solution to alleviate falls in the hospital. The third problem is death caused by airborne illnesses. Again, sharing a room with another patient is not the best idea. A study by Sadit Safavi and his colleagues shows that even though a single hospital room initially costs more, it will cost less in the end due to the spread of infections and illnesses, as cited in Kalar 2017. Secondly, I want to introduce ways in which facilities could be built to allow patients to feel more comfortable and safe during care. As specified by Railing, Hughes, and Murphy, 2008, there is billions of dollars being used to build a hospital. Why is there not a bigger outlook on how it will conform to the patients? Of course, to some degrees, the hospital is being built around patients. Examples would be handicap accessibility, smoking areas, TVs in patients' rooms, and elevators to decrease the time spent walking up the stairs. But to increase the depth of patient-centeredness, designers need to look further. These first elements were identified by Henriksen and colleagues, and that would be to suit patients' convenience by having single bedrooms and providing enough space in the room for family members, as cited in Railing, Hughes, and Murphy, 2008. Another element, which was also found by Henriksen and colleagues, is safety to patients by implementing devices to help with patient falls, the use of natural light, and walls to control noise, as cited in Railing, Hughes, and Murphy, 2008. Lastly, Henriksen and colleagues suggest to provide functions and facilities to meet diverse groups of people's needs, as cited in Railing, Hughes, and Murphy's 2008. All of these functions were created on patients' behalf and may have significant reviews on facilities by patients. In fact, Railing, Hughes, and Murphy's 2008 found that how a facility is built can increase patient and staff satisfaction, stress levels among the patients and staff, and can also increase performance among the patients and staff. To alleviate some of the flaws in healthcare facility design, it is a good idea to get the patient's intake on what would accommodate them the best. According to Goesch and Davis, 2016, page 95, communicating with customers is key to finding out their operations and how they can be served more efficiently. Therefore, communicating with customers could help facilities renovate into patient-centered buildings. I also want to correlate Goesch and Davis, 2016, page 327, essential improvement activities with patient-centered building designs, including communication, correct the obvious problems, look at what caused the problems, document problems and progress, and monitor the changes. Even though some hospitals and healthcare facilities are already built, these skills could help those facilities renovate into patient-centered design facilities. Lastly, Silver Cross Pavilion a patient-centered medical office, has been designed based on needs for outpatient care. At the facility, they have included departments for physical therapy, dialysis, outpatient testing, wound care, and diabetes. Next Core Group 2013. In addition, Silver Cross Pavilion will also be adding a Walgreens in the facility to make it convenient for patients to get their prescriptions when they are discharged. Next Core Group 2013. All the departments have been designed to favor the needs of patients, so everything is in a close range. They will also not have to face the hassle of going through a hospital to receive care. Lastly, Ruth Colby, Chief Strategic Officer, adds that the building design has been a strength to Next Core Group 2013. To conclude, there is a large need to improve health facility designs based on patients. Again, patient-centered design buildings can increase patient satisfaction, alleviate illnesses, and decrease time spent in the hospitals by patients. The patient's privacy, health, and safety needs to come first when it comes to designing patient-centered facilities. It is clear that it will be beneficial for the patients to change the way health facilities are designed.